guys. Welcome to another episode of the Aunty Pharmacist Podcast. Yes, I know it's been a minute and I'm sorry for going AWOL, but things happen, right? And I just apologize, okay? Now I'm back like I never left, okay? And it's the TGIF episode of the Aunty Pharmacist Podcast, right? So you're in for a treat today. Remember, I told you on the last episode before this one that I'll be bringing a new segment to the TGIF episode called the Dear Aunty Pharmacist segment. Like I said, this was born out of the need to actually hear the opinions of some of the patients that have reached out to me via my mail about some issues they encountered in the pharmacy. So it is a place where I give my own perspectives about their questions, about those scenarios, all right, and educate you in the process. Isn't that a good thing, right? Yes. So without further ado, let's get right into it. Oh, yeah, before we get right into it, there were things that happened when I was away, right? The World Toothache Day. I'm sorry, I should have done something on that day, but life happens. Yeah. So, but I am glad that I actually treated halitosis just a few weeks before that day, right? I think it was a week or two before February 9, which was Toothache Day. So, avail yourself of that episode, go and listen to it and learn a thing or two about oral hygiene. That will help as well to alleviate or to prevent toothache, okay? So please do that. Now to the business of today. Today's The Anti-Pharmacist is titled The Confidentiality Issue. All right. So I have received this mail a while back. Yeah. So I've been thinking of a way in which this person that sent the mail to me will not be the only beneficiary, but everybody else will be. And that is how I came up with the concept of Dear Aunty Pharmacist. Yeah, so I'll be reading the mail I received right now, after which I will be responding to it. But I will respond to it in two ways. First, as a healthcare professional, a pharmacist, then I'll put myself in the person's shoes and try as much as possible to see things from their own perspectives. Okay, what I would do if I were them, as unbiased as possible. Yeah. So let me read the mail I received. It says, Dear Aunty Pharmacist, thank you for educating us concerning our medications and health. I really enjoy your topics and learn a lot from them. My name is Shion and I reside in Lagos. Thank you, Shion. I have a question. Okay, so my question is based on the situation I found myself in at a pharmacy in my area. I was feeling some discomfort and had discharge in my private area for some days and decided to visit the pharmacy in order to get treated. I usually get my medications from this pharmacy and I'm even familiar with the female pharmacist that is there because she is very mature, which is why I chose to go there to make my complaint. But on getting there, I met another pharmacist there, this time a male. I was immediately surprised and became uncomfortable. He greeted me warmly though, and I relaxed a little. And he was a handsome guy too. Sheung, you got good eyes, don't you? When he asked what I wanted, I told him how I was feeling, although quietly and reluctantly. Then he asked me to come into his office so that we can discuss better, which I liked because there were other people on the pharmacy floor. But on getting into the office and sitting down, he started asking me questions that made me feel uncomfortable, like if I am sexually active or if I have multiple sexual partners or when last I had unprotected sex. I told him I can't give him that information because I am uncomfortable with those questions. I mean, a fine boy asking me those questions made me self conscious. I didn't want him to see me in that kind of light. He now said that he could not do much for me if I did not answer his questions. I told him to give me anything, but he said he can't unless I am willing to go run a test. And me, I don't have any money for any test. I asked when the female pharmacist will be around, and he said he won't be back. And he said she won't be back until the next week, that he is filling in for her until she comes back. I told him that I will come back to see the female pharmacist when she gets back. He appeared displeased, and although he tried to convince me that the situation may get worse before that time, that I should just tell him what he wants to know, I did not agree and left. I will rather wait for the female mature pharmacist. But my question is, why all these unnecessary and invasive questions? Can't you just treat people based on their symptoms without asking them? Hmm, this is beautiful. Sheung, thank you for raising this question. Thank you for narrating this story to me. I really enjoyed reading it, and I hope that you will enjoy my answer to it, or at least learn something from it. Okay, so these are my reactions. I mentioned earlier that I will react to this in two ways: as a professional, one, and I'll put myself in Sheon's shoes if I was Sheon. Okay, so once again, I want to thank you, Sheon, for sending this question. It actually is what brought about this um dear anti-pharmacist episode. Okay, it's what brought the concept to me. So thank you for that inspiration, Sharon, and thank you for listening to the podcast. Please continue to follow me, continue to share to people as you're learning. Let them learn as well. So the first thing I will address here is um you're being uncomfortable because you met a male pharmacist in the pharmacy. Mm. These are the situations. These are real life things. Okay, thank you for bringing it here, because entering a pharmacy and seeing a male, a female should not matter. Okay, because the profession actually has ethics. There are things we call ethics of the pharmacy profession. All right, just like any other medical profession, we take our oaths once we get inducted, and there are things in that oath that are binding that we must adhere to. We relate with you not as a friend. Of course, we can be friendly. Even pharmacists are known to be the most friendly healthcare professionals. Let me not digress too much. We relate with you as a professional. So it's a no judgment zone. So the ethics of the profession does not allow anybody to judge you or to mock you or to tattoo, tell your story to somebody else. No, it doesn't allow that. So even if you were expecting to see a female pharmacist, which you claimed was a mature, I don't know what you mean. Maybe you see as an older person, or you have interacted with her and you sense some kind of maturity. I don't know. But the fact that you met a male there, I know that, of course, being a fine boy too, you would expect that, oh, this fine boy, I don't want him to see me in this kind of light. You mentioned that, yes, but that does not change things. He's a professional in that capacity. Just like when you go see your doctor and whoever it is, even obgyn are sometimes male, and they will ask you these questions. They are the basic questions to ask. So that should not make you uncomfortable. You mentioned that this pharmacist approached you professionally. He was welcoming. He even took you away from the pharmacy floor to maintain that confidentiality, and took you, I presume, to the counseling room where he can talk to you and where you can talk freely. So you should not be uncomfortable. Okay. Those questions he was asking, they are for a reason. He was asking them for a reason. Okay. And so there is confidentiality. Whatever you share with him will stay with him. Okay. Even if it's somebody you are thinking you are older than, they ask these questions for some reasons, professional reasons, not to judge you. Okay. The ethics of the profession do not allow judgment in any way. So just answer them as you should, and they will give you the solutions you need. Okay. That's one. And The importance of the questions, like I said, is to gain clarity on the causative organism of your condition, okay? To be able to make differential diagnosis, because symptoms overlap. There are many conditions that have similar symptoms or even the same symptoms, but there are questions that have to be asked in order to differentiate one from the other. If you are not willing to answer these questions, like he rightly said, he will not be able to help you, okay? Because is these questions that will be like the guiding light to what might actually be the cause. Another option would be to go for diagnostic test, which this pharmacist of course mentioned. So kudos to you, my professional colleague. You ticked off the boxes. You did the right thing, okay? And sorry for the reception of the patient. They didn't know better, which is why they're asking me, and I'm telling them the right thing to do right now, hoping that when next they encounter such a situation, they will do better, right? Yes. So diagnostic tests are important. They are not a waste of your money, people. When you go to the hospital, for example, your doctors may not be able to diagnose you well based on symptoms alone. Like I said, symptoms do overlap, but this test will point exactly to what is wrong. There are even some tests we call microbial culture sensitivity tests that will tell which organism is involved and which antibiotic or medication will work best. So this makes everything simple. It reduces the cost of money you will waste on unnecessary drugs first before you get the first one and the right one. It reduces trial and error and all of that. Do you understand? So when they ask you to do particular test, don't see it as a waste of your money. It is not, okay? It is to help you streamline what is actually wrong and to be able to hit the nail on the head, okay? Now, I mentioned this earlier. Let's talk about sexism, ageism in today's world. You enter a place and you see somebody that you might be older than, you want to talk down on them, you don't want to respect their professional capacity. That is wrong. Oh, the fact that you're a female, you met a male there, you are feeling uncomfortable with that. No, I think a while back, I was talking to my colleagues about this issue actually, that this sexism is a thing in healthcare space, especially if a male should enter a pharmacy, for example, want to complain about something in their private area, erectile dysfunction, something, they feel more comfortable talking to a male, believing that they will understand better, all right? Or they don't want a female looking at them one kind of way. The same thing happens with a female meeting a male in healthcare setting, like this case that I'm talking about, and they feel like, no, I don't want this guy to see me some kind of way. No, it shouldn't be. Really, respect their professional capacity. Like I said, a lot of obgyns are males. They will do cervical exam for you. They will take deliveries. Of course, there are women that will insist that they want a female obgyn, but that should not be it. What if the professional who is an expert in what you need is a male? Will you refuse the treatment? Please, let's be more liberal when it comes to healthcare. Like I said, there are ethics. Of course, we're human beings, but with time, when we practice over time, we tend to overlook the things that other non-professionals will take as what's it called now, as a big deal. Okay, do you know how many vaginas an object that is a male has seen? Do you understand what I'm saying? So please, let's not be sexist or ageist. Sometimes too, when you get to a place, a healthcare setting, you see a younger person being the pharmacist or being the doctor, you don't want to open up to them. They ask questions and you believe that they are prognosing, they are asking too much. No, please respect their professional capacity. Forget the sex of the person or the gender, forget the age. Please focus on their expertise. They have gained that expertise through training and knowledge. So please focus on that. All right. Also, I will talk about chronicity. That is leaving a condition to fester, delaying treatment. Now, because you did not meet the female pharmacist that you wanted, you went back home with that same condition. By the time you're ready, by the time this female pharmacist gets back, this thing might have aggravated. If it's a urinary tract infection, or even a sexually transmitted infection, it might become more complicated, such that what you would have used to treat it at that time when you reported would not work anymore. If it's a sexually transmitted infection, it could travel up your urethra, even to your womb, to your pelvis, and cause PID, pelvic inflammatory disease. If it is a urinary tract infection, it could cause pyelonephritis for you as a female. Do you understand? It could go to your kidneys. Please do not delay treatment because of biases. Answer questions when you're supposed to answer them and forget it. Okay, there's no judgment. The healthcare space is a no judgment zone. Okay, we listen, we don't judge. Even if we be judging, it's inside our mind. You will not see it in our expression or in the way we talk. Okay, that's just on a lighter note, but really, we listen, we don't judge. And now, let me look at it in Sheon's perspective. If I were Sheon, right? Sheon, if I were you, knowing what I know anyways, of course, I might be reluctant to share personal information with a young, fine guy who is a pharmacist, as opposed to a more mature female whom I believe or expect to be less judgmental. However, my health is my priority. So I will not care what he thinks, so because I was uncomfortable at that moment and I want that condition to go away. I would answer his questions as honestly as I can, get my treatment, and be on my way. He might even have health advice for me that will benefit me and prevent the case from reoccurring. After all, he's only there temporarily, safe. I can come back there in future and not meet him. I can come back to get my medication and meet the other female pharmacists without feeling anyhow or somehow. Besides, I didn't come there to look for husband. I came there to look after myself. So, I will just do what I ought to do, answer the questions and go. Do you understand? That is if I'm in Sheon's shoe. Okay, Sheon, I hope that you've learned a thing or two from this. And I hope that you have gone back to the pharmacy to see that female pharmacist. But this is just in case of reoccurrence and to educate others who might also be in your shoes and think that same way. All right. And that's it on today's episode of the Aunty Pharmacist Podcast and the very first Dear Aunty Pharmacist episode. I hope that you have learned a thing or two from Sheon's story and question. Okay. It is particularly interesting to me because it addresses various topics at once, which I have tried my best to do justice to. Sheon, I hope you listen to this episode and accept my answer and submissions. Also, I have earlier episodes that talks about something similar to this, and it is titled "Do You Trust Your Pharmacist?" You can go ahead and listen to that as well to get better understanding, okay? Thank you so much, guys, for listening. Also, let me know in the comments if you have been in similar situations and how you handled it or what the pharmacist did. Okay. You can send your own questions also to my mail at antipharmacistpodcast@gmail.com. I might just feature them on an episode of Dear Aunty Pharmacist. Do not forget to follow, like, share, subscribe to the podcast. Please share the podcast with your friends and family. These are very important things to help me grow the podcast. People deserve to hear these things I talk about. Please help me get the podcast to as many people as possible globally by doing those things, by sharing, by liking, by subscribing, by following. Doing all of that will help me, guys. Follow Aunty Pharmacist Podcast on all social media handles, on Facebook, on Instagram, on TikTok, and I'm also on X as Farm Podcaster. I also share health content on my LinkedIn page, Demisola Adebisi Joseph. Please engage on my health content or engage on my content. Please help my pages to grow for more visibility. You will agree with me that this information I'm giving to you, they are not cheap, they are premium. Let others benefit, guys. And my YouTube channel is not growing, guys. I'm not happy about it at all. Please, is it because it is only audio? Don't worry, I am starting video podcast soon, but I need your support even now. Before then, please support me. The podcast will keep getting better and better and expanding with your help. So help me grow it. Okay? I am counting on you. Thank you so much for your help so far and for your continued support. I want to wish you a relaxing weekend ahead. Till next time, stay healthy and God bless you. Bye.